Hello guys, this is Dr. Abdul Rehman. Welcome to you and medical capsule. Today we are talking about biochemistry. Biochemistry high yield points for USMLE, Plab, NEET PG and every type of competitive exams. I hope I will make you clear. At the end of this chapter, you will able to answers of many questions as I have discussed in this video tutorial. So let's start with the biochemistry high yield points. High yield points, once again I'm repeating, these are the high yield points for USMLE, Plab and every kind of competitive exams. The main point in biochemistry tutorial is about vitamins. Vitamins are divided into two categories: water soluble and fat soluble. In the fat soluble vitamins there are four: vitamin A, D, E and K. Vitamin A is called retinol, vitamin D is called cholecalciferol, vitamin E is called tocopherol. These are high yield points. Sometimes examiner asks tocopherol is also called, so you will answer it like vitamin E. And the fat soluble, these were the fat soluble vitamins. Now just look upon the water soluble vitamins. So in water soluble vitamins you have vitamin B and C. C is also called ascorbic acid, and B are divided into 12: B1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So now let's memorize it. B1 is called thymine, B2 is called riboflavin, B3 is called niacin, B5 is called pentothenic acid, B6 pyridoxine, B7 biotin, B9 folic acid and B12 cobalamin. Examiners ask this question: pentothenic acid is also called? Your answer will be vitamin B5. These are the high yield points. Remember these points in your fingertips, and I hope you will answer many of your questions in every kind of a competitive exams. Now let's move to hints. I will give you 4 hints that actinomycin D, whenever actinomycin D will come, your answer will be DNA. Whenever HMP shunt is there, they will ask from you about NADPH. Whenever sickle cell disease is present, your answer will be point mutation. And if codon are mentioned, your answer would be 3 pairs. These are just hints. We will use these hints in our video tutorial. Just remember actinomycin D, your answer will be DNA, HMP shunt, NADPH, sickle cell, point mutation, and codon 3 pairs, means codon are made up of 3 pairs. Now let's start biochemistry from the basics. From the basics mean that high yield points, that these questions are asked 100 times in your each and every competitive exam, and I promise you every question they will ask from these points in your competitive exams. So now let's start point number 1. In starvation, there is always increase in pyruvate kinase. In starvation, then you will use how pyruvate kinase you will use. So remember, whenever a starvation is mentioned, you will thought about that pyruvate kinase is increased. Point number 2, mostly Order urine is seen as phenylketonuria. Order urine you will see where? In phenylketonuria. The vitamin that is necessary for post-transitional modification is vitamin K. Decarboxylation need B6. So now if someone asks what B6 is called, and maybe examiner play a trick that he mentioned another name of B6. So be careful, B6 second name must be known to you. The next point is powerhouse of the cell. Generally question, mitochondria. Protein synthesis take place in endoplasmic reticulum. Two types, smooth and rough. On rough protein synthesis, on smooth lipid synthesis take place. Daily secretion of bile by the liver is amount of 500 to 1000 ml. Hemorrhagic disease of newborn is seen due to the deficiency of vitamin K. So vitamin K is responsible for bleeding. Acrodermatitis enteropathica is due to zinc deficiency. Molybdenum is necessary for xanthine oxidase, very important high yield point. Molybdenum is necessary for xanthine oxidase. Hetnub disease is due to the deficiency of tryptophan. Alkaptonuria, we have discussed already phenylketonuria. Now this is alkaptonuria, and alkaptonuria is due to the deficiency of homogentisic acid oxidase. In alkaptonuria, the deposition of substance is homocysteine. Vitamin used to correct neurological symptom is cyanocobalamin B12. We will discuss in our many tutorials again, but these are the high yield points for those exams or at the peak. Wernicke-Korsakoff psychosis, also called beriberi, that is caused due to the deficiency of vitamin B1, and they can also mention thiamine. Pellagra is caused by the deficiency of niacin B3. Burning foot syndrome is caused due to the deficiency of pentatonic acid. Megaloblastic anemia, neural tube defect caused by the deficiency of folic acid, must known to you. And then we have pernicious anemia caused by vitamin B12. Seborrheic dermatitis, this we will discuss in our pathology chapter. Seborrheic dermatitis caused by the deficiency of riboflavin B2. Ischemic heart disease is associated with type of cholesterol LDL, not HDL. HDL is a good cholesterol, LDL is a bad cholesterol. Mind these 2 points. Seen in chronic starvation, we have discussed already that in starvation pyruvate kinase is increased. Now in chronic starvation, insulin decreases, glucagon and growth hormone increases, free fatty acid increases, or glucose tolerance decreases. Now high yield points, put these points into your mind and lock it. Southern blot test is used to detect DNA. Northern blot test is used to detect RNA. Western blot test is used to detect protein. Respiratory distress syndrome in premature infant is due to inadequate secretion of dipalmityl phosphatidylcholine, part of surfactant index of lung maturity less than 2 indicate respiratory distress syndrome. Means the pneumocyte type 2, they release the kind of enzyme, and when there is a deficiency, the child goes to respiratory distress syndrome. Vitamin used for inhibiting lactation is B6, important. Wernicke encephalopathy is caused by the deficiency of B1. Vitamin K dependent clotting factors are, now vitamin K dependent clotting factors are means that vitamin K dependent clotting factors, that they are dependent upon vitamin K. When vitamin K will present, these clotters will be activated. In the absence, they will not be activated. So 2, 7, 9 and 10. Enzyme deficient in Marfan syndrome is lysyl oxidase. Marfan syndrome, a kind of disease in which a protein like fibrillin is deficient. So there is one more enzyme, lysyl oxidase, is deficient. All Krebs cycle, electron transport chain, fatty acid cycle, these all take place in mitochondria. Only glycolysis take place in cytosol. Melatonin is synthesized from tryptophan, and one more point we have discussed about tryptophan, so do not mix these 2 points. Amino acids excreted in the urine in cystinosis is cysteine, ornithine, arginine and lysine. 4 main amino acids: cysteine, ornithine, arginine and lysine. In maple syrup urine disease, the amino acid excreted in urine are leucine, isoleucine and valine. Sulfur-containing amino acids are cysteine and methionine. Conjugated hyperbilirubinemia is seen in Durbin-Johnson syndrome. In Hartnup disease, which amino acid is excreted? Tryptophan. Bile contains cholic acid, chindeoxycholic acid, deoxycholic acid, lithocholic acids. Cofactor for transamination is pyridoxine. Vitamin essential for transmission is B6. So we will continue this next section of this video. Stay with us. Goodbye.